Hi, I'm Dr. Dean Kelaita, the Calaveras County Public Health Officer update for COVID-19 for September 29th, 2020. Statewide, throughout the entire state of California, there have been reported 805,263 confirmed COVID-19 cases with 15,608 fatalities associated with these infections. Calaveras County Public Health confirms 317 cases since the pandemic started within Calaveras County of novel coronavirus infection, now with 14 deaths in our community of our residents. Our county is currently averaging a daily rate of 1.29 new cases of COVID-19 per 100,000 population. So for every 100,000 people, there have been that many cases. That's a rate. And so that compares to the overall state rate of 6.4 new cases per day per 100,000 people. So you can see if we look at it as a rate per 100,000 people, we're doing better than the state as a whole. We're performing 190 tests per 100,000 residents every day. And the rate of positivity has declined. So our positivity rate is down to 1%. That means out of 100 tests, 99 will be negative and 1 will be positive. The overall state rate for comparison of positive tests is 3.6%. Calaveras County has seen a steady reduction in rates of new cases and in the testing positivity rate in the past 3 weeks. So this is good news for our community, and it does track with current trends that we're seeing statewide as well. Now, because of this decrease in our what's called community transmission of COVID-19 cases that's occurring locally here, Calaveras County today has been adjusted in the tier system that's used to monitor counties. So Calaveras has been moved down to what's called the moderate or the orange tier, tier 3. And this is on the state of California's Blueprint for a Safer Economy. This is the system that replaced the prior county monitoring list system, and it's a little bit more detailed with these 4 different tiers. So this 4-tier system rates each county on their disease activity in order to determine what types of social and business activities will be allowed to be conducted in those communities. Because that social and economic activity is one of the ways that people get together and transmission of the disease occurs. So the data for the tier system is reviewed weekly by the state of California for each county, and the tiers are updated on Tuesdays. So to move forward, that means to move to a less restrictive tier. A county must meet that tier's criteria for 2 consecutive weeks. And the converse is true as well. If a county's metrics were to worsen, meaning their rates of disease and their positivity rate were to get worse for 2 consecutive weeks, then that county would be assigned a higher or more restrictive tier. So just for review, the tiers are purple, that's the widespread transmission tier. Substantial transmission occurring, that's red, that's where Calveras has been since this system was rolled out. Moderate, which is the orange tier, that's what we've moved into today, and the minimal tier, which is yellow. So each one of those tiers, as I said, has a certain set of economic activities that are allowed to progress. And so now that Calaveras County has been advanced to this moderate or orange tier, that means that some recently closed businesses may resume or even expand some of their industry-specific business activities, with modifications still in place in most cases. Those modifications are limitations on the number of people that can be in a specific type of business, safety measures that are put into place, that kind of thing. Just to give an example, restaurant services may resume indoors in Calaveras County now at a maximum of 50% capacity, or 200 people, whichever is fewer. Likewise, movie theaters, for another example, can be open at 50% capacity. Those are both now increased that were in the orange tier. Hair salons, barber shops, what are called personal services, such as tattoo, massage, cosmetology, electrolysis. Those types of personal services may also resume and be open with specific modifications that are designed to reduce the risk of disease transmission from person to person. Gyms and fitness centers can resume indoor operations, and now their capacity that we're in this better tier now can be expanded to 25% of their usual capacity. And they can operate an indoor pool as well as an outdoor pool. So that's better for our gyms and fitness centers. Schools are eligible to resume in-person classroom instruction within Calaveras County for our children at the discretion of each school board. And the Public Health Department has been working with the County Office of Education and with the superintendents of the school districts, to come up with some best practices and to reiterate what the guidelines are for safe school, to introduce kids back into the classrooms again. If you want to know more specific business operational restrictions and guidelines, you can visit the state website and click the What's Open in My County listing. And then you put in Calaveras County and it'll tell you what business activities are allowed to be active right now. Nursing homes. Nursing homes across America have been ground zero for this coronavirus outbreak, as I'm sure most of you, the viewers, are aware. Due to the hard work and the dedicated staff, the dedicated care staff, the outbreak of COVID-19 infections at Avalon San Andreas Nursing Home, or what's also known as a skilled nursing facility, an SNF, has slowed down over the last week, which is very good news. And not only has it slowed down, but it's now showing signs, the outbreak is showing signs of abating at this point. To date, just as a summary, 60 residents have been noted to have infection of COVID-19 who are residents in the facility, and 26 staff members have been confirmed positive for COVID-19 through enhanced testing of all of the residents and care staff. So some people have become sick, some people have been asymptomatic, but there's routine testing taking place on both residents and staff on a weekly basis. So this nursing home outbreak represents, in my opinion, the most significant challenge to our community that's been posed by this pandemic to date. The mortality rate among nursing home residents is very high, and we've seen significant outbreaks and mortality throughout nursing homes in California and nationwide as well. So this has been a significant problem in similar settings throughout California and the nation as well. And the rates of new infection coming from Avalon have kind of been fueling some of our increasing community-wide rates of disease over the last few weeks. So the cases coming from Avalon have been contributing to the elevated COVID-19 infection rates for the entire community for the last couple of weeks. So now that the case rates at Avalon have come down, that's also bringing our county-wide numbers down as well, as pure community transmission in Calaveras has slowed down and has remained low for the last 3 weeks. At this time, positive residents at Avalon, once they're identified, are continuing to be temporarily placed in what's called a COVID-19 isolation unit within the facility until they're recovered. And this is a specific activity that can reduce transmission of the disease within the facility to other residents, and they have dedicated care staff to take care of them, and those care staff aren't allowed to go to other residents in the facility outside of the COVID-19 unit. The facility's infection prevention staff have been working closely with our public health department, as well as state regulators and consultants with the California Department of Public Health. They have what's called a healthcare associated infection sort of strike team, which has come to Calaveras and has helped give the facility technical expertise and assistance in managing the outbreak. So CDPH has dispatched what they call this rapid response team, and they've paid a site visit to the facility and have provided that additional support, which has been very helpful in the staff there getting this infection under control through use of personal protective equipment, through disinfection procedures, through the proper cohorting, which is moving people with COVID-19 infection to a special area and keeping them away from people who don't have the infection. All of those disease control activities have been very helpful in abating the outbreak at Avalon. There's continuing to be surveillance every week of every resident and staff for the prompt identification of any new cases, and scaled up infection prevention activities will continue until such time that the outbreak is considered over. So typically an outbreak will be considered over once there's 2 consecutive weeks of testing that's performed and everybody's negative. So once that happens, then the outbreak will be considered over at that time. Another thing that Avalon is doing to help manage the outbreak is they have the introduction of a rapid point of care COVID-19 test now that they can employ in the facility for their residents and staff. This is a test where the results are available in 15 minutes, and this significantly reduces the turnaround time for test results and can improve the efficiency of the disease control response. So the facility and public health have also been in regular communication with Mark Twain Medical Center, keeping them abreast of what's happening in the facility and making sure that the hospital has bed availability, intensive care unit capacity, and ventilator capacity to care for residents who become sick and might require hospitalization. So there are currently 1 resident of Calaveras County who's hospitalized. This is outside of our county. There's currently no county residents who are hospitalized within the county at Mark Twain Medical Center. So that's a good sign because, again, overwhelming of the hospital system is one of the things that we've been very concerned with. Local hospital capacity remains adequate at this time. The hospital has adequate intensive care unit space and capacity. The hospital has adequate ventilator capacity. The hospital has a very robust supply of PPE, personal protective equipment. Those are the masks and the gowns and the gloves and all of those safety equipment that healthcare providers use to protect themselves and also to prevent transmission of disease to other patients within the hospital setting. So all of those pieces of equipment and capabilities that the hospital maintains are really important to helping manage this outbreak in the event that disease activity starts to ramp back up again. And that's part of that hospital preparedness activity that we've been working with the public health department and the hospital on. So again, ways to avoid exposure to the virus are similar messages that we've talked about before. Staying home if you're sick, staying at least 6 feet away from people outside of your household, washing hands with soap and water for at least 20 seconds. An alternative to hand washing is to use hand sanitizer. That's an acceptable option if you don't have access to water, and that can be conveniently carried in a purse or pocket and used when you're on the go as well. Avoiding touching your nose, eyes, and mouth with unwashed hands, and to wear a face covering over your nose and mouth when around others, especially when physical distancing of 6 feet apart is not able to be maintained. Then mask or face covering usage is critical. No-cost testing for COVID-19 remains available for the time being to anyone who would like to get tested. The OptumServe COVID-19 test site remains open for the time being at the Calaveras County Fairgrounds at Frogtown. And testing can be performed there, which is the PCR nasal swab testing. The hours of operation of the testing site are Tuesday through Saturday, 7 a.m. to 7 p.m. Testing's available now for those down to age 3 and over. People are encouraged to sign up ahead of time to make an appointment to come in and get tested. That can be done by registering online or by calling the toll-free 888 number, but walk-in testing will also be accommodated. So again, that phone number for people who don't have internet access is 888-634-1123. To receive more information on how to get tested at the testing site, you can refer to our Calaveras County Public Health website, where we link to resources and information about the testing center, how to register online, and it repeats that toll-free 888 number for those who want to call ahead and make a time to get tested. So getting tested is a very important way of stemming the outbreak in this area as well. So overall, public health officials such as myself are concerned about the potential for concurrent presence of not only COVID-19, but also now influenza virus. And when both of those viruses are going to be circulating together this fall and this winter, that could be a recipe for big trouble for our community. Simultaneous outbreaks of flu and COVID-19 will potentially drain the county's healthcare resources, overload the hospital, and lead to a lot of the negative impacts from COVID-19 that we've been tracking since this outbreak began. Getting a flu shot protects you and your family and has never been more important. So if you're out at a pharmacy, your regular doctor's office, your regular source of medical care, all of those can be sources of getting a flu vaccine this year. Calaveras County Public Health will offer a drive-through flu clinic where you can get a flu shot this season. That'll be on Tuesday, October 15th from 9 a.m. to 4 p.m. at Calaveras High School in San Andreas. The flu shots are available at no cost and can be given to anyone 10 years of age and over. We continue to learn more about this coronavirus every day, and this new information helps guide our public health response to this pandemic. So in closing, I would just want to encourage us to to protect all Calaveras residents against this deadly novel coronavirus. We need to continue to closely monitor how the safeguards that are put into place now are going to be working. And we're going to have to continue to monitor disease activity now that things look like they're cooling off a little bit as we get into the winter and later into the season. This is a dynamic virus, and this situation is subject to change. And this is why we've chosen a low and slow approach when it comes to determining when business activities, when economic activities, when social activities such as gatherings can move forward, and to what degree and with what modifications. So I urge Calaveras residents to continue to limit non-essential indoor gatherings whenever possible, as that's one of the main ways that people can transmit this infection. And this can help reduce the risk of COVID-19 transmission from continuing in our community until such time that a vaccine becomes available. So to continue in a positive direction, I suppose we could put it, the public is urged to do the basics. Continue to wear a mask, keep your distance, get tested, wash your hands, and stay apart. Staying home when sick. Those are just the basic ingredients to being able to continue to manage this outbreak and, again, limp along until a vaccine becomes available and we can get better immunity instilled in our population. So there's no doubt that this situation is further strengthened when we work together to help in the fight against COVID-19. Further information will be released from the Public Health Department on our Tuesday and Friday press releases and on an as-needed basis if necessary. So thank you for your support.